Welcome everybody to week 9. We are going to go into Haemophilus and some other fastidious gram-neg rods today. So this is our first foray into gram-negative rods. Last week we did gram-negative diplococci specifically. So this will be our first kind of foray into the gram-negative rods. Most of the gram-negative rods that we will learn will be in microbiology too, but we'll start with Haemophilus and some fastidious ones here today. So in the Haemophilus group, we're kind of discussing these species over here. Haemophilus influenzae is the biggest pathogen probably out of the bunch, but there's also parainfluenzae, parahemolyticus, and Ducreyi that we'll focus on. So general characteristics, again, these are gram-negative rods and this is again specifically for Haemophilus now. For Haemophilus, they're gram-negative rods, but they're very tiny gram-negative rods. Sometimes they are called gram-negative coccobacilli, meaning they have that intermediate shape between a rod and a cocci, so they're more like oval or ovoid if you think of it that way. So you might hear them called gram-negative coccobacilli, but they are truly a gram-negative rod, but they're just very, very small. I mean, at one point, I think when I was learning first about microbiology, I think I even heard them called like, they kind of look like just junk in the junk in the background because they're just so small and hard to see sometimes. So they're definitely not something that's going to jump out at you always. So again, anytime we have a gram-negative stain, we always want to oxidase test first. And so in this case, Haemophilus are oxidase positive. Now, they are fastidious organisms, meaning they are picky. They need certain nutrients, certain things present for them to want to grow. So most of these Haemophilus are not going to grow in blood agar. That's not going to give them enough of what they need to grow. They like a chocolate agar. That does end up providing them those extra nutrients. And specifically, they want what we call the X and the V factors. X factor is hemin, and then the V factor is NAD. So chocolate provides both of those for them. Now, some of the Haemophilus species might not require both X and V. They might require just the X factor or just the V factor. Each species will be a little different, but just know they are picky fastidious organisms, and this is why they want those extra nutrients. The word Haemophilus itself means they are a blood lover, and so the X factor, hemin, is blood. So they might get the X factor in blood agar, the sheep blood agar plate, but they don't get V factor from that sheep blood agar, whereas chocolate will provide both of those for them. So almost all of these are going to be normal flora of the upper respiratory tract, except influenzae and Haemophilus ducreyi. The others, like the parainfluenzae and the parahemolyticus, are normal flora of the upper respiratory tract. All right, so let's look at a gram stain. I know this is small on your screen. You can definitely look up lots of images online. You can go to your textbook to see other better pictures because they are tiny. You can see it here. They stained well here. They're very much gram-negative, that pink red color. And they are supposed to be a rod. It's hard to see from this view, this level. Are they truly a rod? They're so little that you can see where they were called that coccobacilli instead. Again, look up lots of other images online to help kind of see what they look like. So starting with our big pathogen out of the Haemophilus is Haemophilus influenzae. There are different serotypes of Haemophilus influenzae. They label them A through F, along with some other non-typable strains. So there's many different strains. Now, just because it's named Haemophilus influenzae does not mean it causes what you know as influenza, what the common world thinks of as influenza. Every season, every fall, we think of influenza and getting your influenza vaccine. That is not what this is for. Influenza vaccine is not for Haemophilus influenzae. The influenza vaccine is for the influenza virus. All that avian influenza, the swine influenza, all that stuff is a virus. This is a bacteria. This is different. So just don't get that confused. Haemophilus influenzae does definitely cause respiratory illnesses, respiratory infections. It's just not related to that influenza vaccine and virus. So it is spread because it's related to respiratory infections, very much spread person to person via droplet, via if they're just touching something, that kind of thing. The main illnesses that go with Haemophilus influenzae is meningitis is a big one, especially with the serotype B. So Haemophilus type B, known as Hib for short, was very prevalent in causing meningitis, especially in children that were younger than 5 years. Now, we do have a vaccine created for Hib specifically. So there is a vaccine that is called the Hib vaccine that will help prevent this Haemophilus influenza type B causing meningitis. So that type B was so potent and good at causing meningitis because it had a capsule with an antiphagocytosis ability. So that way it could keep surviving. So there is a vaccine created for that one. It's called the Hib vaccine. Haemophilus influenza can also cause pneumonia, just sepsis, bacteremia. There is a specific infection called acute epiglottitis that it causes. It is actually the most common cause of epiglottitis, or it was at one point. And it might be less now because there is the Hib vaccine, which helps kind of diminish, but there's other strains, of course, of Haemophilus influenza that can cause this. So epiglottis is like your little, it's at the back of your throat, and it's like a little flap that kind of covers your airway. And from like when you have to swallow food, it will close over the airway so you can swallow food, or it'll open up. Like that's the epiglottis. When you have acute epiglottitis, like so if you get this bacteria and it, infects the epiglottis, it causes extreme swelling, inflammation. Itis in the word epiglottitis means inflammation. So the word epiglottitis really means inflammation of the epiglottis. So when they become infected with it, that swells up. And as you can imagine, it really covers up the airway back there heavily and everything. So it's going to be very hard to breathe, very hard to take in food, all of it. So you can see in this picture kind of a healthy version versus what the inflamed version looks like and how much it covers up everything there. So you can see how that is very problematic as an infection. Now, there are other bacteria that can cause acute epiglottitis like Staph aureus and others, but the most common cause has always been Haemophilus influenzae. There is another strain of Haemophilus influenzae. It used to be known as a subspecies. I think they changed that. It was called Haemophilus influenzae subspecies aegypticus. I think they might have renamed it and just now call it Haemophilus aegypticus, but Haemophilus influenzae was linked with it, so that's why it's on the slide. And that is, it has been known to cause pink eye, or what we can call conjunctivitis. So that Aegypticus subspecies, or maybe it's just a species now, has been linked heavily with that conjunctivitis there. So those are kind of the overall bigger diseases that Haemophilus influenzae has been linked with. Of course, it's just lots of respiratory stuff. There's other respiratory illnesses that it can cause infection of. These are just some of the big guys here. All right, parainfluenza and parahemolyticus both are known to cause lots of upper respiratory infections like otitis media, which again is ear infections, conjunctivitis, so eye issues, pink eye, things like that. Can also be seen with lower in pneumonia, so lower lung infections. They also now consider Haemophilus part of what we call the HACEK group, H-A-C-E-K. The H stands for Haemophilus species. The H used to specifically stand for Haemophilus aerophilus. They changed the name of that. That is now called Aggregatibacter aerophilus. So as they learn more about bacteria, they restructure, recategorize. As they learn more features, more information, that's why things get moved around and bacteria get renamed, because they're learning more about it. And like, oh, you don't really fit over here. You fit better over here with this group. That's why things get renamed. And so it gets tricky because you have to stay up to date with it. So it used to be the H in the HACEK group stood for Haemophilus aerophilus specifically. Then they changed the name of Haemophilus aerophilus and said, no, you're better as the A part, Aggregatibacter aerophilus. So the A in HACEK is now Aggregatibacter, and it's Aggregatibacter aerophilus, and then there's some others. And then they changed the H to stand for just Haemophilus species, because it could be Haemophilus parainfluenzae, it could be Haemophilus parahemolyticus, that were part of that H. So we will go into what the HACEK group stands for in a little bit. I believe I have a slide on HACEK. So we're going to hang on to this thought and come back to the HACEK soon. All right, so that's kind of all the mention on parainfluenzae parahemolyticus, mainly seen with respiratory infections for those. Haemophilus ducreyi is a specific infection for STD. It's an STD that's called a chancroid, however you want to say it. I think I usually say chancroid, but everybody has a different way of saying it. So again, still Gram-neg rod, but this one sometimes takes a unique look on the gram stain on what we call a school of fish appearance, or you can call it railroad tracks on the gram stain. So they're definitely still a very small gram neg rod, but you can see the picture here where they're all lined up together. So you can see how it kind of looks like railroad tracks when they're side by side lined up like that. And you can also kind of get the idea of a school of fish swimming along. So you can kind of see both representations there for the Haemophilus ducreyi gram stain. So that's very much, you'll see that referenced as the gram stain for that. Now, again, the disease is an STD called the chancroid. It is a genital ulcer. So past, of course, mode of transmission is passed through sexual contact. Mainly found in certain regions. It's not very prevalent in the US. That's probably why you've never heard of this STD. Most people have never heard of this STD just because it isn't very prevalent in the United States. It's prevalent in other parts of the world. There is no, at this point, there's no FDA cleared test on it that looks for DNA testing. So the NAAT is the nucleic acid amplification test. That is a test that looks for DNA. We can run gonorrhea, chlamydia through the NAAT methodology. We cannot do the Haemophilus ducreyi yet through that methodology. Laboratories can develop their own and come up with it, but there's no FDA cleared one nationally for it. So each lab could develop some kind of technology and come up with their own, what we call laboratory developed test, but there's not a nationally cleared one to look for Haemophilus ducreyi. So you can grow this out, of course, on chocolate agar and culture it like old school without looking for the DNA part. If your lab doesn't have it, you can grow it out on chocolate agar, of course, and work it up that way. So typically somebody presents, we kind of start thinking it might be this because of they present with a genital ulcer and they swab that, we would culture it. And then you go from there. You kind of gram stain and you work it up just like you do any other bacteria. You gram stain it, you oxidase test it next, and so on. And so we'll get into the lab testing part for Haemophilus here. And of course, you want to rule out any other STDs that might cause genital ulcers, like syphilis has been known, always starts out with a genital lesion. Herpes, of course, is genital lesions. So that's HSV is herpes simplex virus. Those have genital lesions. So you have to rule out some of the others and then work this up through culture to identify it as chancroid caused by Haemophilus ducreyi. All right, so let's get into lab testing for these organisms for Haemophilus. Again, chocolate agar is the best because it provides them with those X and V factors. Blood agar, as I mentioned before, does contain the X factor. It does not contain the V factor. There is a special thing that can happen though when Staph aureus is present on a blood agar plate. So in this picture, these bigger colonies here are Staph aureus. The Staph aureus actually hemolyzes the blood cells, you know, in the agar. We know that Staph aureus is beta hemolytic a lot of times, and it hemolyzes the blood cells around it. When it does that, it releases out NAD, which is the V factor. And so then if there is Haemophilus present, that allows for the Haemophilus to grow because now it has both X and V factor. And so that's what we call satelliting, where the Haemophilus can satellite around these Staph aureus colonies. So you can see that these small little pinpoint colonies are Haemophilus on this plate surrounding these Staph aureus because that Staph aureus is now giving them the V that they were missing. So now they have both and they like to grow. So that's just a special phenomenon known as satelliting. MacConkey, even though these are gram neg rods, they will not grow on MacConkey agar because, again, they are fastidious. They are very picky and they want those extra factors present. All right, so here's another look at satellite phenomenon. You can do this as a test in the lab. So if you think you might have Haemophilus influenzae, is the one that really likes to do the satelliting, you can take a streak of known Staph aureus down a blood agar plate, swab next with it your unknown culture swab, and then incubate, and then the next day look to see if there is satelliting present. So that can be run as a test in the lab to detect it. So we can also run X and V factor tests. And in your lab, I think in your student lab, you'll deal with this. You can run X and V factors. There is what we call a Haemophilus quad plate, in which there's different sections of the plate. One section might have X factor only. One section might have V factor only. One section has both X and V factor. And then one section is blank. So we can run a quad plate, streak out an organism on a quad plate and incubate and look at where did it grow, which section did it grow in, because wherever it grew, it said it needed that factor. You can also run X and V factors as little discs. So you can plate out your organism across a plate and then put down discs. Like they look similar to like your bacitracin disc or your opticin disc. So you can put down an X factor disc, a V factor disc, a both an X and V factor disc, and do the same thing to see if it grew around those discs, if that let them provide what they need. So we can run X and V factors as testing in the lab to determine. So the results are Haemophilus influenzae needs both X and V present to grow. It will not grow if there's only X present. It will not grow if there's only V present. It wants both there to grow. So both of those are positive for Haemophilus influenzae. Haemophilus parainfluenzae and Haemophilus parahemolyticus only need the V factor to grow. They do not require X factor, just the V factor. So they can grow in the presence of V factor only. And then Haemophilus ducreyi can grow in the presence of X factor only. It does not need the V factor to grow. And the way that I remember that is that, so as we have learned, Haemophilus ducreyi is the one that causes the chancroid, the STD. Again, we're adults here. Well, you're college age anyway, at least and above. So take this in. If you don't want to use it, don't. So if you think about STD, sexual transmitted anything, you can think about when you see 3 X's, XXX a lot of times stood for porn industry and sex, right? That's how I linked it together to remember this, is it only needs the X factor. So I think of XXX going with the STD. So that's how I always remember that Haemophilus ducreyi only needed the X factor. All right, so here's kind of an example of a flowchart system. Again, we always love to flowchart everything in microbiology. So you have to think about what, are the infection sources. Like most of the Haemophilus, as we learned, cause respiratory infections. So if you're getting something in that's like a sputum from a pneumonia possible, you might be looking for Haemophilus along with other things that are known to cause pneumonia. If you are looking for Haemophilus influenzae causing meningitis, like the CSF sample, if you get CSF in, you are thinking, okay, it could be anything that we've learned that can cause meningitis. So far, we've learned strep pneumoniae, Listeria monocytogene, strep A lactate, now Haemophilus influenzae. And then there's others, of course, to come. So anything like that, always think about like where these occur as infections. So you want to inoculate chocolate agar plate. CAP stands for chocolate agar plate. So anytime you might think there might be Haemophilus present, always set up a chocolate agar because, again, it loves the chocolate agar. It will give them what it needs. And then you always gram stain it. If it's a gram neg-rod, you're oxidase testing it. If it's oxidase positive and it's only growing on chocolate agar and it's not growing on the others, then you're like, ooh, it might be Haemophilus. Let's do X and V factor testing. So then you can look at, okay, how did it respond to the X and V factor? So in what way did it respond to it to be which one of these, to kind of separate and determine which one of these it is. So that's kind of the classic old school way of working up a Haemophilus. Okay, moving on to some other fastidious gram neg rods. So we have the Haysick group. I said we were going to come back to that, along with some of these other guys that we are going to discuss. So the Haysick group is a group of bacteria that are all gram-negative rods. They're all fastidious, and they are all known to cause slowly progressive endocarditis. So that is why they're kind of grouped together. So here's the similar characteristics. As I said, they are all gram-neg rods. They're actually also all capnophilic, meaning they need extra CO2 levels to want to grow. They are all fastidious, as I mentioned, so they need extra nutritional requirements. They are typically slower growing, and most are found as normal flora of the oral cavity. Actually, all of them are found as normal flora of the oral cavity. So that is why they've been grouped together, is they are all causing the same kind of infection. They all share these features together. So that is the Haysick group. So the members of the Haysick group are the Haemophilus species, again, particularly Parainfluenzae parahemolyticus, Aggregatobacter species, particularly Aggregatobacter actinomyces comedens, and then Aggregatobacter aprophilus. That is a big word to say. C stands for Cardiobacterium hominis, E is Eichinella cordens, and K is Kingella species. So those are your members of Haysick. So that is all you need to remember, the members of Haysick, and then what they all cause, that slowly progressive endocarditis, and why they were grouped together. Now, of course, some of these can also cause other things, like Eichinella cordens can cause other things besides just endocarditis. Same with, we've already learned Haemophilus species causes lots of respiratory stuff. So it's not just endocarditis. This is just why they've been grouped together for that part. So speaking of Echinocordans is a gram-negative, again, capnophilic, found as normal flora of the oral cavity. It has been known to pit the agar when it grows. So this is a chocolate agar plate showing Echinocordans. And it's hard to see, but it's making kind of a, like, you see where it's like kind of cloudy there with clear there. That's where it's like pitting down into the agar plate. It'd be easier to see this if they had it kind of on an angle or a side view to see that pit. But that is a unique feature of Echinocordans, is it makes that depression into the agar. The other thing with Echinocordans is it tends to smell like bleach. So that does kind of have a specific odor to it. So the way that I've always remembered that is cordans to me reminds me of the word corrosive. And I think of bleach as being corrosive. So that's how I link that together. Again, these are gram-negative. So if you oxidase tested, it will be oxidase positive. We've already said it's normal flora of the oral cavity, part of HASIC. The other infections that it tends to be linked with is clenched fist wounds or human bite wounds. So because it's found as part of the oral cavity, if you were to punch somebody in the face, so that's where the clenched fist wound is. If you are fighting, you punch somebody in the face and hit them in the mouth, and their saliva gets into the opening on your fist, and that is where it causes infection. So it can then cause infection of that fist wound. Or if somebody bites you and passes it out of their normal flora that way on the bite wound. So that is other infections that it's been known to cause besides just the endocarditis being part of the HASIC group. Capnocytophagia is a organism that is found as normal flora of the oral cavity, also needs increased CO2 capnophilic to grow. This is mainly found, especially oral cavity with dogs and cats. I should say that. I didn't say that yet, but it's mainly found with animals. So as a result, think about what it's going to cause for an infection. Anytime an animal bites you, then it can pass that, normal flora to your bite wound and cause an infection. So that's mainly what capnocytophagia has been linked with, is dog and cat bite wound infections. It can be involved in some other stuff too. You can see that this is mainly like all mouth stuff, dental plaque, periodontitis. That's all mouth, oral cavity kind of stuff. Now, this is a gram-negative, but this one is oxidase negative typically, and that's all I need you to remember for capnocytophagia. Pasteurella is another gram-negative rod. This one is oxidase positive. This one has a unique feature on the gram stain, and that has like a safety pin appearance. So I kind of put like a diagram down here to show you what it means by that. You can also see it here in the gram stain. Kind of looks like they're a little bit more plumper looking gram-negative rods with that bipolar staining. It really stains heavily at the two ends. That's why where it makes the safety pin appearance, is because it's staining more heavily at the two different ends. This one does have a smell associated with it as well. It's been known to be musty smelling or mushroomy smelling. Pasteurella multocida is our main organism out of here. If you see any Pasteurella, it tends to be multocida. Again, found in the oral cavity, also respiratory tract of animals. So therefore, it's heavily linked with animal scratches, animal bites. Really well known to be linked from cats, especially. So anytime you get a case study question that's describing an animal wound, an animal bite, you're thinking about the ones that we've learned that are being linked with animals. So Pasteurella multocida is one that should definitely always come to mind. Capnocytophagia could be one as well that come to mind. So link it with animal bites or animal scratches. Brucella species is a gram-negative coccobacilli, very much still fastidious. That's why we're talking about it here. Depending on the species you get, depends on the animal host that it's linked with. So Brucella abortus is more from cattle, melitensis is sheep or goats, Swee is from swine, Canis from dogs. So you do need to memorize those. Mainly, we have eliminated Brucella in the United States. Unless you're drinking like unpasteurized milk or something like that, then you might be at risk for it. But Brucella is heavily linked with bioterrorism. It has been known to be a bioterrorism weapon. And again, the reason people choose bioterrorism weapons, as I kind of discussed with anthrax, is what is easily passed from person to person and what causes the most harm to that patient. That's how they choose bioterrorism bacteria. They're looking at how can they make this easy to get? You don't need a lot of it to cause harm to that person, and it's passed easily. So that's always why they choose their bioterrorism weapons. So Brucella is one of those. So anytime we suspect about Brucella, we want an escalated level of safety cabinet. So mainly in microbiology labs in hospitals, you are working with a BSL level 2. That's a hood. The biosafety or hood level 2 is what we typically work with in a hospital setting. For Brucella, anytime you're suspecting Brucella, or if you're working in a larger microbiology department in a really large hospital facility like Barnes Jewish down in St. Louis, which is a prevalent facility, huge micro departments, Mayo in Rochester, you probably already got level 3s because you're getting sent in specimens from different sites. So anytime you get, you're a larger micro, you probably already have a level 3. But if you ever suspect Brucella, you can only work with it in a level 3 to protect yourself. So this is kind of what a biosafety level 3 would look like. It's a lot more enclosed. A biosafety level 2 is still a hood with the proper ventilation, but it's a little bit open still. You're kind of working under it, but it can still be open. Whereas a biosafety level 3 is now kind of is all closed altogether. So that way there's no risk of opening here. So for Brucella, can be transmitted through breaks in the skin, ingesting those food products. Like I said, if you're drinking unpasteurized milk, aerosols in lab conditions, that's why it's essential to get it under a level 3. So then once you get that infection inside of you, it disseminates quickly. It spreads throughout your different organ systems and causes damage, inflammation to those organs, lungs, liver, spleen, central nervous system, bone marrow, and then it's causing all sorts of inflammation, damage to those sites. So again, it was previously used as a biologic weapon. It is still thought of as a biologic weapon. It can always come up again as a biologic weapon. So specimen collection, blood, bone marrow, wherever we think getting a biopsy from an infected tissue, that kind of thing. It does want to increase CO2 levels. It is fastidious, so it's picky about how it grows. Testing wise, like I said, gram-negative coccobacilli, oxidase positive, and then there's some other tests there. So it is just a very notorious little thing to be working with in the lab. I don't make you remember a lot about the testing wise of Brucella for the rest of this, but knowing those strains that go with the different animals is essential there. Francisella tularensis is another zoonotic bacteria, mostly coming from rodents, rabbits, beavers, muskrats. So anytime you handle like one of those infected animals or a dead animal, or if there was a vector like a deer fly that bit that animal and then comes and bites you, if you're eating the animal, anything like that that deals with the animal, of course, you're going to pick up what we call tularemia. Tularemia is the infection caused by Francisella tularensis, the bacteria. So again, this doesn't need a lot of organism to give you an infection. As low as 10 organisms can cause an infection. It can start as a skin infection, as you see here in the picture, what we call ulceroglandular tularemia. So it's like a skin ulcer, but then it can spread in your body. If it can get deeper, it can spread and cause those kind of same lesions that it caused on the skin to your organ system. So it can be quite damaging. So clinical manifestations, lots of different, as you see here, the symptoms are similar to any other infection, but it can also be occasionally a respiratory disease, so not just ulcers on the different tissues. So there is what we call a pneumo kind of side to tularemia, and that's been linked with bioterrorism attacks as well. So Francisella tularensis is another bioterrorism weapon because, again, you don't need much of it to cause infection. It can be passed respiratory-wise as well. So it is another BSL level 3 pathogen. And again, it's picky, so it likes to grow in chocolate. It also can grow in an agar called BCYE agar, buffered charcoal yeast agar. It's a gram-negative coccobacilli, oxidase negative. So this is different than Brucella. Brucella was oxidase positive. Francisella tularensis causing tularemia is oxidase negative. There is still very much tularemia present in the United States. So because it's passed through those rodents, rabbits, muskrats, beavers, we definitely still see reported cases of tularemia. So this was CDC back in 2022. So just a few years ago, here is where it was found. the different places that it's been known to be found. So you can see it's found in Minnesota, North Dakota, Wisconsin areas, because we do have muskrats, beavers, rabbits, rodents. So again, anytime you're handling that, we do see tularemia. So if you work in micro department, you could see tularemia come through. So it is something that we always want to be aware of and, you know, looking out for. The next one is Legionella. So another gram neg rod that's fastidious. This loves to grow on the BCYE auger as well. So Francisella tularensis grew on that auger. This one does too. And the reason why Legionella really likes to grow on BCYE is because it requires both iron and L-cysteine for growth. And that buffered charcoal yeast extract auger, BCYE, gives it those two items so it can grow. So that's where it's fastidious. The dominant organism out of Legionella is Legionella pneumophila. This has been what we know of as Legionnaire's disease. So that is a pneumonia respiratory illness. So the word pneumophilia tells you pneumonic illness, but we tend to call it Legionnaire's disease. And the reason it got named Legionnaire's disease is when it was first discovered back in 76, it was discovered at an American Legion. So that American Legion had an air conditioning system, and Legionella loves itself an air conditioning system. It's wet. It provides a nice wet environment for it. It loves to live in water. And so that air conditioning system was contaminated with this Legionella pneumophila. And as you can imagine, as it blew out air conditioning through the vents, it blew out Legionella pneumophila through those vents. And so those people that went to that American Legion inhaled it and became very sick with pneumonia from it. They cultured it, they figured it out. So again, I think that was around 1976 that they figured this out. And it happened in Philadelphia, I want to say. And so they have now named it Legionnaire's disease as a result of where they first discovered it. So here's what the buffered charcoal yeast extract auger looks like. Again, it's buffered charcoal. Charcoal is a black color, so that's why it looks like a black auger. So there it's growing on that auger plate. And our last fastidious gram neg rod is Bordetella pertussis. This is what causes whooping cough. So we do have a vaccine, of course, to prevent against whooping cough. There is selective augers that you can use to grow if you think you are suspecting whooping cough. So if somebody comes in and they're not vaccinated and they have that cough, there's a very specific cough, they have the symptoms, we would take a respiratory swab. So typically it's a nasopharyngeal swab is what we want to culture. If they are too young to get a nasopharyngeal swab, there is ways to get other respiratory sample from them. And then we could use regular media as well, but you can also use selective media if you have it. So Bourdain and Go, Jones Kendrick, or Reagan Lowe have all been good to isolate and screen for Bordetella pertussis. So do remember those auger plates for Bordetella. Gram neg rod, in this case, oxidase positive. All right, so that is lots of little organisms. I don't go into depth on every single one of those gram neg rods toward the end there. Just big picture overview of each one because it's a lot to take in and remember. So as long as you know some of the key big picture characteristics, I think you can get through questions and sort through which one is which. Okay, so that is it for week 9. I hope you guys all have a great week. Thank you.